Got pectoralis major, right? Clavicular head, sternal head, abdominal head. All right. We got deltoid, and here, anterior head here, middle head there. If we want to see the posterior head, we got to flip this up a little bit, right? So you see the posterior head, deltoid there. Then let's run down anterior arm. So we're moving pec major, pec minor out of the way. Lift up here. We got biceps brachii. And if we're in between the split there, short head on the medial side, long head on the lateral side there. Then we're going to take biceps and we're going to move it over, and attached to the short head right here, we have coracobrachialis. And then if we come down to the distal end of biceps, move it out of the way, under here, in that area we have brachialis right there. So that's all anterior side. And we're going to flip this up, posterior side. We have triceps brachii here. If we're looking on the posterior side and kind of get in between the split there, we can see long head here, lateral head here. We can see where they combine, come down, they go to the olecranon process of the ulna there. If we want to see the remaining head, the medial head, we have to bring the arm back around. So we'll come around this way, switch with me here. Come over here. We're going to go right there. So I'm kind of right in between two spots here. So this is still long head, and then this whole part, we'll kind of outline it like that. That's all medial head. So here you can see medial long, other side you can see lateral and long. And one more here. We come over to the lateral side of the elbow, we move that fascia out of the way, and we have anconius right there. Okay, let's go to anterior forearm now. So first muscle we want to find is brachioradialis. You can see that here. We're going to go medially. Next one we're going to come to here is going to be pronator teres, right there. Then we got flexor carpi radialis here, and then palmaris longus right next to it. Then we come all the way over to the medial side, and we have flexor carpi ulnaris. Then we have to move things. So then we're going to take these two muscles here, flexor carpi radialis, palmaris longus. We're going to move them out of the way. We uncover now flexor digitorum superficialis. We're going to take that muscle. We're also going to move that one out of the way. And now we uncover flexor digitorum profundus, and over here, this guy, which is flexor pollicis longus. And then lastly, we spread those two apart, and we open that up, and we can see pronator quadratus right there. Then we go to the posterior side, and you stay here, I'm gonna go over there. All right, so then here, now we still have, here's brachioradialis, so we start back on that one. Now we're gonna work our way around the other side, and we have these two muscles here. This would be extensor carpi radialis, longus and brevis. Longus is the one that's a little bit more superficial with the longer connective tissue. So longus, brevis there, right? Then we come here, let me use this. Just gonna come under here. We got this guy here. This is gonna be extensor digitorum. And then right next to it, that little guy is extensor digiti minimi. And then we keep on moving, and right next to it here, get under it right there, that's going to be extensor carpi ulnaris. Then we're going to loosen the wrist so we can take extensor digitorum and kind of move it over out of the way like that. And here, create a little space in there. We got four muscles, 1, 2, 3, 4, and that's going to be abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and then extensor indicis. All right, and that would take care of the forearm. Then we come over to the hand. Let's do dorsal hand first, since I'm here already. Only thing you're going to have on the dorsal side of the hand are going to be dorsal interosseous muscles. We can see the first dorsal interosseous right there. If we kind of move that, there's the second one. There's the third one, kind of right there, and then there's the fourth one over here. So you got 1, 2, 3, 4 dorsal interosseous muscles. Now we got to come back around to the palm side of the hand. All right, so we do this here. So we get to the palm side of the hand, and we have the palmar aponeurosis that piece of connective tissue. Connected to it, we got a little muscle right here, which is going to be palmaris brevis. On either side of those things, I'm just going to fold palmaris brevis over. We have two regions, thenar eminence here, hypothenar eminence there. We have muscles in those eminences. So here, kind of lift up. This is going to be abductor pollicis brevis. If we go medial to that, here we'll have flexor pollicis brevis, and if we go lateral to these guys, I'm going to move them over like that, that's opponens pollicis. So those are the three in the thenar eminence. Then we come over to the hypothenar eminence, and we'll kind of move this stuff a little bit. And here we got the same 1, 2, 3 muscles: abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. All right. Then the next thing we're going to do is take the palmar aponeurosis and kind of flip that down. And here we're going to locate the tendons for the flexor digitorum muscles, and we're going to go to the thumb side of each of those. So we go right there, and we got a muscle here. That's your first lumbrical muscle. Open this up a little bit. There's your second lumbrical muscle. Kind of move that one over a little bit. There's the third lumbrical muscle, and if we move this over a little bit right there, there's the fourth lumbrical muscle. Now, what you're not seeing here is deep to those lumbrical muscles there, you're going to have 1, 2, 3 palmar interosseous muscles. So you're not going to be able to identify those. But if we move the thumb away from the index finger here, we can see in between the thumb and the index finger, this whole area there is adductor, D as in dog, pollicis. And I think that's it for the hand in terms of the muscles. Only other thing is you should be able to recognize the difference between the tendons here and this. Let's see if we can get this. Maybe I'm not. Don't know. It's a little dry. It's not going to let me do this here. There we go. Oops. Like that. There we go. So of these, what I have the probe under there, that is the tendon for flexor digitorum longus, and what's coming up in between it right here is the tendon for flexor digitorum profundus. So you should be able to identify those muscles here and there. Then it goes to vasculature. Right? So here, forceps. Okay. So here, we find the anterior scalene muscle, we see subclavian artery emerging from under it. Now, we're missing one thing off of your drawing here, and that's going to be the costocervical trunk, which should be coming off right here. I think it's branching off, but it's a bit under anterior scalene, a little hard to see. Don't worry about it. But it should be right here, at least it was on her. Then we got this branch going inferiorly. That is your superior thoracic artery. Go down a little farther. We got this guy going over towards the pectoral muscles, and that's going to be your thoracoacromial trunk. Then we got this one going medially towards, see, we can grab serratus anterior. We see it going there. That's your lateral thoracic artery. Then we go down a little farther, and here, right at this spot, we have this branch going medially here. That is going to be your subscapular artery, all right? And if we follow subscapular over, so if I kind of hold it like that, you can see that subscapular splits, see right there? And that is going to be subscapular becoming thoracodorsal, which goes over towards latissimus dorsi here, right? And then this one, which is going to wrap around the scapula, and that's going to be your scapular circumflex. Right on the other side, if I kind of move this over, you see we're in between two vessels there, a skinnier one and a thicker one between it. That's going to be your anterior humeral circumflex artery and your posterior humeral circumflex artery. Then we come a little farther down here, and you can see you have a bunch of branches, kind of 1, 2, 3 of them there. Those are all deep brachial arteries. Sometimes there's one, sometimes there's more than one. Here we got a couple. Then you come down a little farther. All right. And here we have your brachial artery. We have your brachial artery splitting into your radial, which goes down towards the thumb, and your ulnar artery there. As ulnar passes under pronator teres, we have a branch off of it. It's going to become your common interosseous. Don't worry about seeing that one. Common interosseous will then split into your anterior and posterior interosseous, and those, well, at least the anterior one we can see pretty well right there. All right, so here's your anterior interosseous as it passes underneath the pronator quadratus. The ulnar artery we can see continuing right here, this guy. So you see here's the ulnar artery, here's where it passes underneath those muscles, so we can see it again there. We can follow this down towards the hand, and right here we can follow that ulnar artery coming down to where it loops around in the palm. So this is where we become that superficial palmar arch, where it would join up with your radial artery over here. So the radial artery is going to pass underneath the thenar eminence and emerge to join into that little arch right there. So again, superficial palmar arch, and then coming off of the superficial palmar arch, we have these vessels here, which would be common digital arteries, right? And then if we follow that down, you can see a good picture of it right there, where common digital splits into proper digital arteries on either side. That was as far as you needed to go down for the arteries. Let's do the superficial veins. We can see right here, right, something like that. So right, you go to the anterior side of the elbow in the cubital fossa, and we look for these superficial veins. So on the lateral side here, we have cephalic vein, which continues down there. On the medial side here, we have basilic vein, which would have continued down, kind of broke off, right? And then we have this connection in between cephalic and basilic, and that would be your median cubital vein. So that would be the superficial stuff there. Then last thing would be the nerves. So let me go over to the other side. And let's see here. So come back up to anterior scalene, move that down. You got a really clean picture here of the roots of the brachial plexus, right? So that's C5, C6, C7, C8, T1. They join together to form trunks, which we can see right here is inferior trunk, middle trunk, superior trunk. Then we get the divisions, which if we kind of move it apart here, we have the anterior, posterior division of the inferior trunk, anterior, posterior division of the middle trunk, and then if we kind of move that over, there's anterior, posterior division of the superior trunk. Then they combine into chords. So we can see that we have anterior, middle, anterior, superior forming lateral chord. We have anterior division of the inferior trunk becoming the medial chord, and again notice how they're on either side of the artery there, right? And then behind it back here we have all the posterior divisions coming together to form the posterior chord, and that's posterior to the axillary artery. Then we come down here, we get a nice picture of that M shape, right? We can really see it well right here, and this is going to be your musculocutaneous nerve, median nerve, ulnar nerve. And then if we kind of move that stuff out of the way a little bit there, let's get this little artery out of here. Right here, that is your posterior chord becoming your radial artery, or I'm sorry, not artery, radial nerve, and your axillary nerve right there. Okay. And that's it pretty much, right?
So
Pretty good? Okay.